Welcome to Module 2, Adolescent Development and Healthcare Transition. This is the second of 10 modules in the course, Healthcare Transition Training for Healthcare Professionals. By the end of this module, you will be able to describe adolescent development stages and define healthcare transition stages. This module provides information on adolescent development from the third edition of Bright Futures and Evidence-Based Models of Care Management. This module outlines transition stages that occur during adolescence. Healthcare transition is part of the developmental process. Independence in all areas of life, such as school, work, home, and recreation, are important for developing skills that make healthcare transition easier. Transition is an individualized process. Some of these suggestions will be better suited to younger or older children, and not all the suggestions will be useful for everyone. Include these suggestions where appropriate in your interactions with youth and families. You may already be familiar with the key adolescent developmental tasks. In the next few slides, we will review the early, middle, and late adolescence. This can be an especially difficult time for adolescents with chronic health conditions. All teens at this age are self-conscious of and anxious about their appearance and body shape. With the move to middle school, old friendships often end. Making new friends can be difficult for teens who are different than the typical. Key developmental tasks of middle adolescence are to become more independent and autonomous, to rely on one's own judgment, and to forge independent relationships. It is typical for youth in middle adolescence to feel that their parents or caregivers cannot really understand them, and to begin to rely on friends for support and advice. This is also the time when many youth engage in risk-taking behaviors or try new things. Adolescents with normal cognitive development are becoming more capable of complex problem-solving and decision-making. This is an emerging skill. Youth need the opportunity to practice and learn how to consider multiple elements simultaneously, systematically, and exhaustively. Late adolescence marks many life transitions. By the end of this stage, the patient attains all legal rights of adulthood. However, brain development continues until around age 25.
Your responsibility for your own health care?
I guess if I would have noticed something, it would have been because there was a change. But since there was no change, I just like learning how to walk or talk or learn to read. I mean, I don't know how many people remember learning how to read. I just remembered how to answer questions by myself, and I was always a part of the clinic visit. I didn't ever feel like I was just being talked about. I was usually questions were directed to me, so I never really had a different experience to compare it with. So I just kind of always learned to report what was going on with me, and that was about it.
Through your life becoming more independent and more responsible?
I guess early on I always kind of remember being able to rattle off all the medicines and the dosages I was on, especially when the nurse came in and took down all my vital signs and asked me what meds I was on and whatnot every time. I was always able to relate that. Mom very rarely helped me with that after I could grasp dosages and different types of medication. So I in particular, that was always kind of my responsibility to tell them about different medications I'd been on in the past few months, if I'd been on any antibiotics, things of that nature. So I always kind of kept my prescriptions in line. Somewhat. I guess at the time it was kind of like I didn't really think it was all that abnormal. I thought maybe certain kids had to do this, certain kids didn't, and I was just kind of explaining that I was taking a pill for to digest food. So I don't really recall any particular time doing that. But I know I had to explain it at some point along the way. So, I mean, it wasn't, I really didn't think that was that big of a deal. I guess I can remember Mom telling me or asking me what I'd tell kids. And I remember getting frustrated with her just because, I mean, why would you ask me that? I'm just going to tell them what it is. So I guess that's how I handled it. I didn't really make a big production or get worried about it or anything.
Yeah.
The difference in my experience and some others' experience is that I never thought that doing any of that came at a different time than I would go in and buy my own Tylenol off the shelf if I have a headache. I remember initially calling the pharmacy to refill prescriptions. I remember her just giving me the bottle and saying to call this number and go in and refill it. It wasn't that big of a deal to me, and then I rode my bike down to the corner and got it filled. So I guess the biggest deal about that whole experience was that she had to call down and make sure it was okay for me to take a check that she wrote. I mean, in terms of actually refilling my own prescriptions and things of that nature, I don't know if it really wasn't that. I mean, a lot of this stuff was, they say it was big steps for them to let me do it. I'd never really looked at it that way. It was more like, I can do it, Mom, so why don't you just let me do it? I guess it was all need to be independent. I've always wanted to be more independent than not. I don't really like having my time or anything else dictated to me. I'm naturally independent. So I think that natural independence kind of filtered through to everything I did, not just regarding my health care, but everything. So when I went off to college from high school, I was never happier to be able to do my own thing, and it's kind of reversion to come back home and be here and have some rules again, but it's not so bad anymore. But yeah, in terms of independence, it was just kind of natural to me, filling out my own prescriptions, taking my own medication, setting up my own treatments at school. It was I guess, if anything, it was out of a want for my mom not to be there or anybody else to be there to monopolize my time or what I was going to do during that time. So I guess I was naturally independent, and I guess from that standpoint, they've always let me be as independent as I can be. And so that's been nice. They've allowed me to do whatever I need to do.
Successful healthcare transition is a long-term developmental process that is comprised of 3 stages: envisioning a future, age of responsibility, and age of transition. The age of transition is divided into 2 phases, early and late. The age ranges for the stages serve as a point of reference and will vary based on the abilities of a given patient. Envisioning a future is a critical first step in the long-term process of transition. This stage starts at the time of diagnosis and continues through early adolescence. Envisioning a future recognizes that the child will become an adult and the importance of transition preparation. During the age of responsibility, a child should receive steadily increasing levels of responsibility for their own healthcare management, medical decisions, and household tasks. During the early phase, the adolescent and family gather information related to healthcare transition, start setting specific goals, and develop a written plan for achieving these. The young person assumes a more independent role in working with healthcare professionals and making medical decisions. Parents and caregivers support the youth's increasing autonomy. The late stage of transition begins when the adolescent turns 18 and gains new legal rights and responsibilities related to confidentiality, consent to treatment, and medical decisions. In this phase, the young adult and their family must begin the process of transferring to adult medicine. Health insurance considerations arise throughout this phase. Throughout adolescence, there is a greater importance of development for youth with special healthcare needs. They may face more barriers to fitting in and developing self-efficacy as they realize the effects of their specific chronic condition. It is important to help youth develop positive health habits, self-care skills, and decision-making skills before they reach middle adolescence. Issues related to the adolescent's chronic health condition should not be the subject of parent-child power struggles. Early adolescence is the beginning of the process of letting go. It is critical that parents encourage their child to be more independent. During middle adolescence, many teens also want more privacy. They may put up a "please knock" or "do not enter" sign on their bedroom door as a way of establishing their own boundaries. Again, it's important to let caregivers know that this is a normal part of growing up. This is also the time when adolescents establish some emotional distance from their parents and want to spend more time with others their own age and gender. Parents may feel hurt that their child no longer shares everything with them, yet this is a normal and necessary part of adolescent development.
I guess just encourage independence is the whole point. I now cook for myself and for my parents. A little deal we worked out. Early on in my life, they taught me to be independent, and I think at this point, Mom had a little song that she used to sing about independence, and it's now come back to haunt her because I tell her to do things for herself. But ultimately, I think independence is a very important thing. I was able to go off to school. I can show my friends what I'm able to do. Physicians, I think, ought to ask, is your child able to do their laundry, to, I don't know, balance a checkbook, and encourage parents to get their kids involved in that sort of thing.
This section describes practice-based strategies for addressing transition that are complementary to adolescent development. As the child becomes a teen, the tasks of pediatric care include supporting the autonomy of the adolescent, promoting the teen's self-efficacy, and finally, facilitating the interdependence of the young adult. By age 18, young people should be able to answer all of the doctor's questions, know what questions to ask, and be assertive to get the care that they need. It is much easier for youth to prepare for transition gradually than to do so abruptly. This process takes time. Youth with chronic health conditions and disabilities will have a growing knowledge of the effect that their health problems or limited capabilities can have on their futures. Supporting optimal psychosocial development is a significant service that healthcare professionals provide to families. Children with chronic health conditions who develop and maintain friendships with peers are more likely to become independent and happy adults. Good social skills significantly increase the probability that an adolescent will successfully transition to adulthood and compensate for limitations in cognitive and motor development. Self-efficacy is defined as the belief in one's own capabilities to organize and execute a course of action that will achieve specific goals. Promoting self-efficacy involves helping adolescents to make good decisions and to gain the knowledge and skills they need to be successful and to have confidence in themselves. Healthcare professionals play a key role in teaching families and youth what issues need to be addressed, providing transition-related information, identifying resources, identifying priorities, and developing a plan to address these priorities. Fishful Thinking is a website sponsored by the National Association of School Psychologists. It includes tip sheets and strategies for building patients' sense of self-efficacy. Their tools are useful for many different professions.
I've always, especially with my current doctor and also Dr. Rosenberg, always treated me as if I was, I was never looked down on. Because I was younger. I was always asked the most serious or direct questions about my health were asked directly to me, and they valued what I had to say about it. They weren't types of doctors that would just send me to lab tests and get some blood and then they'd decide what was wrong with me. I was very involved in the process of my health care, and I was always involved in the decision making based upon what my symptoms were, how my treatments were going to proceed. They always kind of included me in that decision making process. So that I think is very helpful and continues to be. Continues to be nice to know that they're actually listening to what I'm saying and at times are letting me control some of the treatments and letting me control how my healthcare is proceeding. That's nice.
Planning for healthcare transition also involves a discussion of other transitions, such as from high school to work or higher education. Talking about these future events illustrates the connection between health and achieving future life goals. During this early stage, parents or caregivers should begin to coach their children so that they can answer one or more questions at a medical visit, and so that they are comfortable asking questions about treatments, medications, and the future course of their conditions. In addition, parents should also be encouraged to give their child choices whenever possible. For example, allowing the child to choose what clothes to wear to school provides them practice in making decisions and also gives them a sense of control. Ask families to envision a future for their child. Of course, the future is uncertain and plans may change over the course of a child's development. However, envisioning a future makes it more likely that families and ultimately young adults will think about their lives and make plans accordingly. It is critical that parents or caregivers and ultimately patients ask these future-oriented questions, even when there are no clear answers. Once parents have envisioned their child working or living independently, it will be natural for them to provide opportunities that will move them toward these goals. Independence and self-care is a building block of living independently and being employed. Middle adolescents should have responsibilities such as chores around the house and expectations for the completion of school assignments. At the same time, they need opportunities to develop independence in the areas of finance and interacting with other adults. Involvement in community and activities with friends are also important during this time. People with disabilities are at a much higher risk of sexual victimization than people without disabilities. This is true for women and for men. People with intellectual or developmental disabilities are especially vulnerable. Conversely, patients with intellectual or developmental disabilities may need education to recognize when their own sexual advances are unwanted or inappropriate. It is critical to address these topics during middle adolescence, despite reluctance. Do not assume that another provider will prepare the patient or family for this aspect of adolescent development. This resource offers guidance for providers to appropriately discuss sexual health and developmental disabilities with patients, parents, and caregivers. During the age of responsibility, the patient needs opportunities to take an increasing level of responsibility for daily self-care and general health care, and to learn how to handle the responsibilities of staying healthy, eating well, getting enough exercise, etc. This stage is especially challenging for parents or caregivers of children with complex care needs, who have been very involved in the care of their child for many years. Examples of taking responsibility for one's own health care include telling parents when the supply of medications is low so more can be ordered, and calling doctors to make or change an appointment with supervision from parents. During this stage, the challenge for parents is to move from the role of doer to that of coach. The Canadian Hospital for Sick Children provides guidance for parents and caregivers of youth with special health care needs on supporting their child's growing self-efficacy. Encourage youth and families to think about what skills they will need to be successful in the next phase of life. Can the young adult live independently, attend college, maintain employment, and navigate life in the community? Healthcare professionals play a key role in helping families and youth to understand what issues need to be addressed, providing healthcare transition-related information, identifying resources, and supporting them to identify priorities and develop a plan to address these priorities. In the late phase, the young adult and their family need to begin the process of transferring to adult-oriented providers and to develop a plan for assuring that they have health insurance on an ongoing basis. Healthcare professionals can also help young adults to understand that interdependence is a sign of maturity, that they can and should make good use of all available resources, support, and guidance as they move from school to work, from home to living independently, and establishing a family of their own. Take a few moments to consider how you will introduce the transition stages with your patients and their parents and caregivers. How will you weave this into your existing anticipatory guidance conversations? This slide will automatically advance in 1 minute, giving you time to write down your answers to the question. Before closing this module, we will review the resources for use in your practice. The AAP's website offers many tools for implementing the third edition of Bright Futures. Many of the images and information in this presentation came from the third edition Pocket Guide. The AAP's Bright Futures Visit Planner and Visit Forms provide many tools for implementing the anticipatory guidance included in this presentation. Some tools are available for free to AAP members, and some are available for purchase. Information on these tools does not constitute an endorsement of a commercial product. All children should be given an increasing level of responsibility for their own health care, in keeping with their physical and cognitive limitations and strengths. Use the links from this course's toolkit to access the resources from this module. The relationship between adolescent development and transition stages plays an important role in the next module, working with parents and caregivers. You can pause the presentation for a quick break or continue directly on to the next module.